Here we are. Welcome to the TRT, Tuesday Resilience Training. My name is Ana-Christina Hicks, and we are sharing tools of hope with the Resilience Builders. My special guest today, our special guest is Dr. Robert Bray. So Robert, we just thank you. Bob, we just thank you for being here. We love that you're here, and we're just excited to be able to get your topic today on Get an Instant Stress Reset for Depression and Physical Pain. You are also the author of Heal Traumatic Stress Now. I love this book. What I love about it is that you give some explanation at the beginning, and then you give really quick and simple tools of what you're teaching us today. So you can literally jump to symptoms that you're having and use this tool that he's going to teach us, which is based on TFT, so that you can go from discouraged, tired, and stuck to inspired, clear, and strong. So really quick, let's do a little bit of housekeeping. If you need to reach Dr. Bray, it's rlbray at rlbray.com. And he's in California, but one of the cool things about him is he can do things virtually. There are some counselors and therapists that can't cross state lines, and the thing is, he can, and he also specializes in trauma. If you want to reach me, or if you need my emails so that you can get the CEU information, it's hope@toolsofhope.com. So just email me, hope@toolsofhope.com, and ask for the CEU information. Housekeeping notes, this is being recorded. What we're going to do is do the training at the beginning, and then I will shut off the recording and we will do the live Q&A session. During that live Q&A session, we're going to maintain an environment and atmosphere of confidence and trust, because we are about honor, respect, and encouragement. So super quick, if you want some additional resilience resources, you can go to resilienceresources.toolsofhope.com. And if you want to get training for your team, a lot of people ask me, hey, can you actually do live training? Can you do virtual training? Can you give us some recorded training? The answer is yes. Get a hold of me at toolsofhope.com. And then we're going from there. Here we go. So Dr. Robert Bray, we just want to welcome you to our class today. Thank you so much for being here.
Yes, it's always a pleasure to be here. Ana-Christina and I have been working together for several years now, and I'm always so pleased when she invites me to do a presentation or an interview with her, because I know that she is reaching the people who need these services the most, and that she's reaching out to folks who put themselves constantly in situations that stress their bodies beyond what we would normally expect. So I'm very pleased to be able to share this with you and help you with it. What am I? COVID's caused me to struggle with some redefinition issues along the way, but primarily I'm a psychotherapist who specializes in traumatic stress response. And I've been doing this for 40 years, getting on there. I'm also do training, a lot of training in thought field therapy. And I'm a trainer for the International Critical Illness and Stress Foundation. I've done numerous trainings and conferences across the country. So I'm pretty familiar with the kinds of ways that TFT can be helpful to people. So I'm in private practice, so I do that about part-time and about half-time. And then I also do trainings and do this kind of work too. So I just want to put it out to anybody who's interested. If you find what I'm saying is useful or helpful, and you have a forum for passing that along, please do. You're welcome to pass along my website, any of my YouTube videos. None of this information is going to harm anybody. And that's what I want to make sure you understand, that today I'm going to be talking not just about the psychodynamic and body responses to traumatic stress, but I also want to make sure that you learn the very basics of thought field therapy. And thought field therapy is a technique that began almost 40 years ago with Dr. Roger Callahan. And it's what's described as a Meridian point stimulation treatment. And basically, we're going to be using the same information they use in acupuncture and acupressure as a way to communicate to those parts of ourselves that need some healing or need some adjustment.
Nice.
And so I want you to know it's been around for a while. I know there's over 140 peer-reviewed published studies about thought field therapy or energetic psychology or some derivative of thought field therapy. There's been over 40 randomized trial studies. There's been 4 meta-analysis. All of that is to say that there's good research that shows that it works. And it was recognized by the National Registry of treatment programs when the federal government still had it as the only PTSD treatment using this kind of energetic work.
Wow. So Bob, really quick question. I love all of the statistics and.
Yeah.
Really, here's what I love about what you teach, okay? Number 1, it works, whether you understand it or not. Number 2, it helps you feel better, faster, think more clearly. And here's the really big one for me. Without having to air any dirty laundry.
That is the beauty of it.
That is the beauty of this tool. And so I just want to throw that in there as you and I met at a huge ballroom at a national event where we were both speaking, and we happened to be speaking at the same exact slot. And we were both bummed that we couldn't go to each other's sessions. But the bottom line is you don't have to open up a bunch of can of worms to have this work. And you don't even need to understand how it works. However, it's critical to understand how trauma works and why sometimes talk therapy can't work the way that it needs to, which you do some talk therapy. I'm just saying, right?
Oh, I do a lot of talk therapy. And the thing you need to understand is that with trauma, it's a whole person experience. It affects the body, the mind, the spirit, and it also puts into place some very specific survival mechanisms in the bottom of our brain, the part of ourselves where we hold information, where it comes in, where we filter it, where we react to it, where we hold learning. And all of that part of our activity does not have language. So that's why cognitive therapy has limitations. It helps you think about things. It helps you plan. It helps you organize. It helps you make decisions and to enact those decisions. But all of that happens in the top of your brain when you're not overwhelmed by the bottom of your brain. Because the bottom of your brain is going to say, well, we don't have time to think. We just need to react to stay alive. And so you begin to filter information in a specific way. You begin to respond in specific ways that in many cases block the activation of that interface to the top of the brain where we can do those other things. Now, that's a good thing in a life and death situation. One does not want to stop and think about what's the best move here. You want to move. You want to freeze. You want to do in that instant without any delay. So it's good in that sense, but the problem is that once we get into that, we oftentimes find ourselves into a loop of finding ourselves overwhelmed easily. Now, that's why if you work in the field of trauma, you're going to be exposed to a lot of people who are expressing symptoms of depression and symptoms of pain because they go hand in hand. I don't know anyone who's had some significant trauma in their life that doesn't end up with, at some point, some symptoms that look very much like depression. And often, because of the physical injury that accompanied the traumatic stress injury, you end up with physical pain. And so thought field therapy can be very helpful in bringing that healing about and in resolving the pain and in bringing some more joy to your life. One of my kind of standard definition of depression is a lack of joy in one's life. So if you have had some significant trauma that has impeded your ability to express your own passion and desire and to experience joy in the world because you're too busy looking for the next dangerous thing, you're going to feel depressed. So tapping has been shown to be very helpful in reducing that. And I do encourage you that you can look up the stats, you can look at the numbers and all that, but the most important piece of evidence for you or for people you're trying to help with this is their own real life, immediate experience. And so you can do tapping with people and it will not cause harm. Either it works or it does nothing at all. 90% of the time, you're going to get some kind of positive result. Now, so this is part of what you have to remember is the research that really matters is your own experience and the experience with those people you work with who you can trust their reliable report and who you can see the change happening with rapidly. So because we're working with energetic systems of the mind and the body, we're working with the informational control mechanism that defines how we are manifested in any given moment or experiencing things. The results are often immediate. So you're going to feel some of it. Maybe it doesn't go all the way all at once, but you will be able to notice that it's happening. If you don't notice that it's happening, don't worry about it. It just means that you need an additional technique or you need a different pattern of tapping. So you really can't harm anybody with this, and you can't harm yourself. So I like to just take people through it so that they can begin to get a sense of what it's like. So if you're watching this now, just tune in to what's going on inside of you, because become aware of your body and notice if you're in your body, you feel any pain. Now, that pain might be a chronic pain or it may be something that's situational, but if you're feeling it, we can try this tapping to help you with it. Now, the other thing is if you're lucky enough to not have any physical pain in your body, but you are struggling with some depression, give it a minute to focus on that. My experience is that people who have depression, especially chronic or ongoing depression, know that beast very well. And it lives in a certain place or a certain sensation or experience in your body. Sometimes you have trouble getting into your body because you just go numb. Sometimes once you're in your body, you just feel so heavy, you have no energy and can't react. Sometimes it's like you just get into this frozen place and you can't really even begin to think about anything else. So however you recognize depression in yourself, take a moment now and let yourself feel it. Now, it's fine at whatever level you feel it. So in TFT, thought field therapy, we try to communicate using a scale that helps us know what things mean. Because if you tell me you're in a little bit of pain, I don't know what that means. But if you tell me that you're in pain on a scale of 0 to 10, with 10 being the worst pain, that you're at a 4, I have some sense of that. When you say you're at an 8, I have some sense of that. And the more important piece is then after you tap, we can go back and use that same scale to help you recognize what's shifted for you. Same thing with the depression. 0 to 10, how bad is that depression right now? How strong is it in you? If it's, a 10 would be, I'm so depressed, I really don't want to get out of bed and I'm having trouble listening to you. However you experience that the most. So when you have depression and pain together, it's really horrible because the pain says there's no hope, right? And the depression feeds on there's no hope, right? And when you have no hope, then the physical body begins to give up, and is not operating in an optimal way at all. And so that feeds back into the pain because maybe what you need to do is to get up and move or get up and go take one client. I have to constantly remind her that if she takes a Motrin, she'll feel better, but when she's in it, she forgets about that. And she can't even get herself up to go take that. But she'll do that and she feels significantly better as soon as it kicks in. And then it's like, oh, why didn't I think of that? Well, you didn't think of that because you're depressed. And so we have to struggle with that. So anyway, so what you do with this, you have the person go into your body, because that's how we know reality. We experience reality through our bodies. So go into your body, notice what reality you have right now in regards to either pain or depression. Put it on a scale of 0 to 10. And then we start tapping. Now, the points we're going to tap on, this first one is side of hand, and then under nose. These are Meridian treatment points. And if we were acupuncturists, we could stimulate them with a needle, or you can just do it with pressure, just pushing, or I like tapping because then you can have a sense of what's going on with you. So we did side of hand, under nose, and then I'd like you to tap the back of your hand. Okay, now that's between the two small fingers and a ½ inch towards the wrist. Now you're going to keep tapping while we do 9 things very quickly. Close your eyes for a moment. Open your eyes. Look down into your left, just with your eyes. Look down into your right, just with your eyes. Okay. Now, I want you to hum, and then count out loud 1, 2, 3, 4, and then hum again. Okay. And then I want you to keep tapping the back of your hand. And just keep tapping for a while. Now, usually in thought field therapy, we would say tap 30 to 50 times, depending on what you're treating. But you'll notice after you've been tapping for about 20, 30 seconds, okay? And then you're going to tap underneath the collarbone. So you just go to the notch in your throat, down an inch, over an inch or so, either one side or the other. Under the collarbone, just tap there. Okay. Now, what I did this time is I wanted to take you through it so you could see what it looks like. So I showed you the 9 gamut series. So we did a brief tapping on the back of the hand, and then we started the 9 gamut series. This is the gamut spot. And so usually with pain or with depression, we're going to do 30 to 50 taps here. Then we're going to do what was the 9 gamut series, the 9 things we did. And then we repeat the tapping from before. So I want you to just take a moment now and go inside and notice what you feel. Now, it could be, if you're looking at pain, go back to where the pain was before and see what's going on. If the pain has moved, that's a good thing. If the pain has been reduced, it's a good thing. Even if it doesn't go all the way, less pain is better. If you go back to that depression, that heaviness, you might feel a little lighter. If you go back to that confusion or difficulty focusing, again, what happens with depression and pain, you may find it a little clearer to be able to focus. So I'm going to do this again with you, and this time I'm going to make sure that we do the 30 to 50 taps before we start the 9 gamut series. But it's good to go through this again just so you get the feel for it. So tapping on the back, side of hand, we're going to correct reversal, and we're going to go under the nose. And then we're just going to tap the back of the hand. And settle into it. This is the longest tapping point we have. Most of the time we tap, 5 to 10 times in any position, not much more than a dozen times usually. And on this particular one, we go to 30 to 50. And you'll get a sense of what feels better for you to do that. And then you're going to come and tap under the collarbone. And then we're going to do the 9 gamut series, tapping on the gamut spot. Close your eyes for a moment. Open your eyes. Look down left. Look down right. Whirl your eyes around. Whirl your eyes back. Hum. Count out loud. 1, 2, 3. Hum again. And then we're going to repeat what we did before. So let's tap the side of the hand. Tap under the nose. And then tap the gamut spot again, 30 to 50 times. And what you're going to do here is after you've got that, then you're going to go back and tap under the collarbone. Notice I'm tapping on the other side. It doesn't matter. The meridians run on both sides of the body. You can go either way. And then stop. And let me stop my phone here. So again, go back and notice what's happening in this reality, in this moment in your body. Because that's how we know reality, is through the experiences of our body. And how's the pain? How's that sense of depression? Now, if any of this has been moved you in the right direction, then you know what? Try it again. Do it again until you don't get an improvement. Okay. And remember that you can use it as much as you want. So let's say that you were tapping on the pain. The pain went from a 7 and it's down to about a 3, and you tap again and you're getting to a 2, and then you feel okay. And then later tonight, you start to feel the pain again. Don't wait till it goes back to 7. When you start to feel the pain again, tap again. Same thing with the depression. So good luck to you. And please, rlbray@rlbray.com. That's my email, my website. Feel free to reach out if you have questions. And if you have other places that I can do this, I would love to help spread this word to more people. So thank you.
Thank you very much, Bob. So, part of what I noticed is even when we were practicing, when you were just kind of showing us, the places where how we're going to do it, mine went from a 7 to a 6. Just even think like, wait, that was just practice. That's part of what's happening. See, that's part of why I love this tool so much, is to say, you don't have to understand it. You don't have to get it. Maybe just having that sense of how trauma works, and trauma gets stuck in the part of the brain that doesn't have language. So that's okay to use a tool that doesn't have language, right? We're not having to say what happened or why we think the trauma's here, or the depression or the pain. Well, why am I hurting here? Well, we don't need to actually necessarily know that to get a little bit of relief, right?
Well, and to know that those things are linked. Now, I will tell you, if this is not working for depression or for pain, you may need to go back and treat the original trauma. So if you're thinking about the pain in your hand and your wrist, you may need to go back to that event where your injury occurred. And as you think about that, you may need to do the tapping for traumatic stress relief, or crisis tapping pattern.
So
it's on our website. It's in the book.
Yeah, I love that you bring that up. So I mentioned earlier in the session that you do talk a lot, and you have I just love this because they're really short sections. Okay, so as you go through the book, there's only 2 or 3 chapters. There's actually 5 parts, but my point is there's not that many chapters. And Bob he talks a lot, but it's like in short chunks, like 2 pages. So you can jump into whatever you need to jump into for 2 pages, okay? Well, what I really love is after he explains that stuff, and whether you want to take the shortcut or not, okay, to understand all of that, he literally lays out the basic steps. You have the foundation. He just gave you the foundation of how this works. But you have the basic steps for traumatic stress, basic steps for anxiety, phobias, fears, addiction, or addictive urges, spiders, claustrophobia, air turbulence, addictive urges, depression, physical pain, which is what we did today, rage. Now we're getting into that energy, okay, and the emotion, rage, shame, embarrassment, anger, guilt. So just how he lays it out is so powerful. And the tool that he just taught us, we can then go back to the YouTube. I will be posting this on YouTube, and you might be watching it on YouTube. As you can go back and even write it down for yourself. He just gave you this huge gift, talking you through it. Or my plan is to go and kind of bookmark it and know that I'm going to go to 5 minutes and 51 seconds where he starts the exercise, and I can start to get that more ingrained in myself. So thank you for sharing. Thank you for sharing this.
And we're trying to make it as easy as we can for people to use this. If you go to my website, there'll be a place where you can sign up and give me your email address. It's one of these things. You give me your email address and I'm going to send you, it's like a 30-page, this is what you need to know about TFT and how to help yourself with it and to begin to assess, do you have PTSD and what you do with it. So it's all there for you. You just have to step out and do it.
Thank you. Thank you. Bob, thank you so much for what you do in the aspects of trauma for first responders and for victim advocates. Thank you for what you've been doing for 40 years. I know you were, we had a conversation before, is that you actually were a first responder as a wildland
firefighter.
Yeah, yeah.
And I was a lifeguard for a while.
Yeah.
So I've done some emergency response work on a national medical team also.
Yeah, thank you. Thank you for what you do. Thank you for what you've done. Thank you for sharing with us here today. So this is Dr. Robert Bray. You can reach him at rlbray@rlbray.com as email, or at his actual website is rlbray.com. So you can reach him there. You can get your free 30-page, really the further work on the foundation that you just taught us. So here we go. This is Ana-Christina. We are sharing tools of hope with the Resilience Builders. And this has been the Tuesday Resilience Training, where we share quick and simple tools that help you give an instant or get an instant stress reset for the helpers. This is Ana-Christina, and we'll see you in the next session.